Hi again. Now we are in the fighting unit and it is called blood. Okay, so remember we're gonna be first reading in English, then translating into Spanish, and then we're gonna do just read the exercises but just in English. Okay, let's start. I'm ready from the book, so that is why you see me with the looking down. Okay, let's start. Blood A. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count (FBC). A full blood count measures the following in a sample of blood: first, the amount of hemoglobin; two, the number of the different cells: the red blood cells, erythrocytes; white blood cells, leukocytes; and platelets or thrombocytes; three, the volume of the cells; and four, the erythrocyte sedimentation rate (SCR), a measurement of how quickly red blood cells fall to the bottom of a sample of blood. B. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to first bleeding, loss of blood, excessive destructions of red cells, or the low production, for example, because the diet is lacking or deficient in iron. Okay, now this is a conversation. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. The professor said, "What's the most likely diagnosis in this case?" And the student said, "Most probably carcinoma of the bowel with chronic blood loss." And the professor said again, "What's against that's as a diagnosis?" And the student said, "Well, he has any change in his bowel habit or lost weight." Professor, what is you include in the differential diagnosis of severe anemia in a man of his age? And the students say he may have leukemia of some sort or plastic anemia, but that's rare. It will be unusual. Another cause is iron deficiency, but, but he seems to have well-being unusual. Another cause, okay, but he seems to have an adequate diet. Professor say, okay, no, there's another cause of anemia, which I think is more likely. Student, chronic bleeding ulcer? Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? And the student say, well, he's got none of the typical neurological symptoms like parasitia. Okay, see, this is pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his book. And we're gonna be reading this further. Okay, pernicious anemia (PA) is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sortum glossitis is sometimes present. Patients with symmetrical parasitia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset is beginning, insidious, is slow developing, pallor is lack of color, meal is slight, jaundice is bilirubinemia, okay, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continuing to develop, and palpable, can be felt with the hand. Okay, so now we're gonna be translating all of that. Remember. Okay, sangre. Hemoglobina completo. En la investigación de enfermedades sanguíneas, la prueba más sencilla es un hemograma completo. Un hemograma completo mide lo siguiente de una muestra de sangre. Primero, la cantidad de hemoglobina, el número de las diferentes células, dígase glóbulos rojos, eritrocitos, los glóbulos blancos, llamados leucocitos, y las plaquetas o trombocitos. El volumen de las células y la velocidad de sedimentación globular, una medida de la rapidez con la que los glóbulos rojos caen al fondo de una muestra de sangre. Ok, anemia. La anemia es una de las enfermedades sanguíneas más comunes. Puede deberse a hemoglobina perdida en la sangre, perdón, hemorragia, pérdida de sangre, destrucción excesiva de glóbulos rojos o baja producción, por ejemplo, porque la dieta carece de hierro o es deficiente de este mineral. Ahora, un estudiante de medicina ha examinado a un paciente mayor de edad, o sea, ya bastante, digamos, anciana, con un nivel muy alto de hemoglobina y está discutiendo el caso con su profesor. Ok, el profesor dice, ¿cuál es el diagnóstico más probable de este caso? El estudiante responde, lo más probable es que un carcinoma de intestino con pérdida crónica de sangre. Profesor, aquí dice, ¿qué impide ese diagnóstico? El estudiante dice, bueno, no ha tenido ningún cambio en sus hábitos intestinales ni ha perdido peso. El profesor, ¿qué más incluiría el diagnóstico diferencial de anemia grave en un hombre de esta edad? Estudiante, puede tener algún tipo de leucemia o anemia aplásica, pero eso es raro. Sería muy inusual. Otra causa es la deficiencia de hierro, pero parece tener otra dieta, parece tener una dieta adecuada. Profesor, de acuerdo. Ahora bien, hay otra causa de anemia que creo que es más probable. Estudiante, úlcera sangrante crónica. El profesor, de acuerdo, sí, correcto, pero ¿qué hay de la anemia perniciosa? ¿Puede descartarla? Estudiante, bueno, no tiene ninguno de los síntomas neurológicos típicos, como parastesias. ¿Sí? Parastesias. Hice anemia perniciosa. Jordi Ponce, el estudiante de medicina de Barcelona, ha hecho algunas notas lingüísticas de su libro de texto. Ok, la anemia perniciosa (AP) es una afección en la que se produce atrofia de la mucosa gástrica con la consiguiente insuficiencia de la producción del factor, con la presencia del factor, ok. La anemia perniciosa (AP) es una infección en la que se produce atrofia de la mucosa gástrica con la consiguiente insuficiencia de la producción del factor intrínseco y mala absorción de vitamina B12. Al inicio es insidioso, con síntomas de anemia que aumentan progresivamente. A veces dice que los pacientes tienen un color amarillo limón debido a una combinación de palidez y ictericia leve causada por la degradación excesiva de la hemoglobina debido a la producción ineficaz de los glóbulos rojos en la médula ósea. A veces se presenta una lengua roja y dolorida, que se le denomina como glossitis. Los pacientes presentan parestesias simétricas en los dedos, de las manos y de los pies, pérdida temprana de la sensibilidad vibratoria y debilidad y ataxia progresivas. El vaso puede ser palpable. Okay. Now we're gonna be reading the exercises just in English. Okay. The 15.1 find words in the bus with opposite meanings. Look at B and see opposite to help you. Now we're gonna be reading the 15.2 and it's make word combinations using a word from each bus. Look at B and see opposite to help you. So I just choose those words and it's bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing in vibration sense. Okay, now 15.3. Complete the sentences. Look at A, B, and C opposite to help you. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by the vitamin A deficiency. 3. The bleeding and purpura are caused by abnormal platelet function. 4. The white cells count is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctiva is probably due to jaundice. 6. There was a palpable mass in the right upper quadrant of the abdomen. 7. Treatment is semen and restoring fluid balance with adequate intravenous fluids. And 8. The anemia may be due to increased red cells breakdown. Okay, and 5.4. Complete the conversation. Look at C or positive to help you. Professor, what is again the diagnosis of pernicious anemia? Physical examination. A student says the problem started quite suddenly, so I didn't have the typical insidious onset. He doesn't have any skin pallor and he doesn't have symmetrical parasitia or absent vibration. Since and I couldn't for his spleen. Professor, what about his tongue? His tongue was normal and not inflamed or sore. Okay, so that's all for this chapter. See you in the next chapter. Bye.